Mel, can you print me the paperwork to Galloway front desk? I did.
Of this, and then Melody, I will make sure to get this to you afterwards, after it's downloaded. So good afternoon, everybody. I appreciate everybody joining. My name is Bruce Arman. I'm one of the partners out at my law firm, Saul Ewing. Have worked with the practice for many years on a variety of different issues, and this is something that we periodically do because it's important. And it's important for compliance reasons. For some of you who have been around the healthcare block for a little bit of time, not much of this should be new, but it's always important to have a refresher. As Dr. Lehrfeld had said, there's a short quiz that we've prepared for everybody. It's 11 questions long. It's going to include some of the HIPAA information we're going to cover, as well as some of the labor and employment and OSHA issues that my colleague Lisa Coblin is going to talk about. She's on the Zoom call as well, and she'll be presenting after we go through some of the HIPAA stuff. This is obviously intended to be interactive, even in a Zoom type setting. So if folks have particular questions, you can certainly feel free to interrupt me or Lisa as we're speaking, or you can send something in the chat box, and I'll try and periodically look at that to make sure if there's any questions that I'm addressing those questions accordingly. So we'll jump through a variety of different slides. There's a lot of slides in here. We're not going to cover each point on each of the slides. The important takeaways is to make sure that all of you, whether you're a senior physician or a brand new medical assistant who started, that we're all in this together in terms of the things that Jersey Urology Group needs to do. Compliance shouldn't be viewed as an added burden for what you have to do as part of your job. It's just part of your everyday job, that you don't have to think about some of these things, that they become intuitive for you in terms of what you look to do. So we're going to cover three big subjects today. One is the Health Insurance Portability and Accountability Act, or HIPAA. One is the New Jersey Law Against Discrimination. And then the third area is OSHA, the occupational and safety and health issues that with COVID are obviously important and becoming more and more relevant, and thought it appropriate to give a refresher on those things. The next slide, you've all seen something like this, and anybody who's worked in healthcare for any period of time knows what HIPAA is, but this is just a short, friendly reminder about it. It's really, 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 if I haven't emphasized enough, really important to make sure that we respect and honor and maintain the integrity of all different types of patient privacy. When they come in to see us, they're coming in to see you as a trusted healthcare professional, and we need to uphold that end of the bargain. Even when you're seeing multiple patients in a day, and the patients might have concerns about things, or they're anxious about their ailment or an upcoming surgery or recover from surgery, just really keep this at the forefront of your mind. You're doing excellent work before COVID became a known phenomenon, during this whole COVID crisis, and certainly once things get back to our new normal, and we just need to constantly maintain and respect patient privacy in terms of what we need to do. So what are we going to cover today with respect to the HIPAA angles? And we could spend several hours on this. Dr. Wren insisted I get done by midnight tonight, so we're not going to have time to get through all of it in the detail that I want. But we're really going to try and cover over the next 50 or 55 minutes or so. First, this area of HIPAA. And when we talk about HIPAA, there's a couple different subcomponents to it. There's the privacy rule, there's the security rule, and there's a breach notification rule. And then obviously talk about your responsibilities under HIPAA in terms of what you need to do. Just a brief history. The statute was passed now 24 years ago. It seems like an eternity. The regulations have been out since 2000, 2001. The act was subsequently amended a couple of times in 2009 and 2013. This is a federal law, so it applies to all the different states. One of the important things to remember, as it is a federal law, in most circumstances, a federal law is superior, if you will, to a state law. With the case of HIPAA, they've inverted that a little bit. So if New Jersey has any more what they call stringent privacy rules, those more stringent privacy rules apply, and HIPAA becomes the floor and not the ceiling in terms of what the level of protections that we need to deal with. So mental health type issues, drug and alcohol abuse issues, HIV type disclosures, are all the sort of things that have an extra level of scrutiny or an extra level of protection that we need to be mindful of above and beyond what HIPAA itself provides. Couple of components to it. Again, we're going to walk through each of these different components in terms of what they mean, but a lot of people just say HIPAA and don't realize there's lots of different sub elements to it in terms of what we need to think about. Very basic, but important to remember. The privacy rule, which is the first of the rules we're going to talk about, sets up national standards to protect what they call protected health information, or PHI. Some people like to use the acronym PII. It's actually really PHI. And this level of protected health information applies to what they call covered entities, Jersey Urology obviously being a covered entity, or we wouldn't be having this presentation today. What is protected health information? It's a pretty broad area of descriptors, and it's basically anything that could be used to identify who you are as opposed to who somebody else on this call is. And however it's maintained in any form, whether it's old-fashioned paper, whether it's in the cloud, whether it's on somebody's phone, the laptop, whatever it might be, anything that can basically identify you as who you are is considered to be protected health information. What are some of the examples of PHI? All of these things on the screen and things beyond that. So if you're not sure if something's considered to be PHI, and you'll see this as a common refrain as we go through things, ask Melody as the privacy officer, ask one of the physicians, ask Dr. Lehrfeld, who does a lot of the security issues for the practice. Really, really important that we make sure we maintain the protection of all of these different things. And we'll talk in a couple of minutes about this as well. But one of the other important takeaways, and sometimes people often forget, your responsibility as you're caring for your patient is to that patient. If somebody's not your patient, you should not be accessing his or her records. In places like Los Angeles and New York, folks have gotten in trouble because if there's a particularly famous or infamous person who might be getting care from a particular provider or a particular hospital, people think it's fun to go look up that person's records and see information about him or her that is otherwise not meant to be disclosed. Even if we don't have somebody who's particularly famous in our practice, but somebody who might be a neighbor or a friend or you know something about, you can't access that information unless you're directly involved in the care of that individual. So really be careful about that. Curiosity in this regard is not a good thing. If you don't have a reason to access a person's records, don't access that person's records. So we first talked about protected health information, which is really the key. There's a broader category called health information, and you can see the definition here in health information. I apologize, it's a little wordy there. This is actually what came from the regulations. It's very, very broad, dealing with the past, present, future, physical or mental health of a person, and it's received from a variety of different places. So lots of different protections out there. When the statute was passed 20 some years ago, the goal was really to make sure that patient privacy was protected. It was really before the onset of EMRs, the onset of regular use of computers, believe it or not, as funny as that may sound. And they were very concerned about patient information getting into the wrong person's hands. The privacy rule, as I said before, applies to what they call covered entities, healthcare providers who do electronic transactions, which again, today is virtually every healthcare provider out there, including Jersey Urology Group. We're covered as a covered entity, and we need to make sure that we're bound by HIPAA. All of our colleagues in the practice are bound by HIPAA and understand its restrictions. The health plans of the world, the Horizons, Aetnas, Medicare, Medicaid, they're all considered health plans. They have protections as well that they need to abide by. Then there's this third bucket of covered entities called healthcare clearinghouses. Those are folks who move information back and forth between one party or another. They're also covered by it. But for purposes of our discussion today, just remember, and it's common sense, Jersey Urology Group is a healthcare provider. We're a covered entity under HIPAA. So remember, we talked about protected health information. The general rule is we, Jersey Urology Group, can't use or disclose a person's protected health information except if it's allowed under the rules. One of the big exceptions that they placed in the rules is we can share PHI for what's called treatment, what's called payment, and what's called healthcare operations. These are all specifically defined terms. Or there's a scenario where we could use or disclose PHI if we get a HIPAA compliant authorization. And one of the things that we've done for the practice is create a privacy manual and a security manual, and there is a variety of different forms in there. So if for some reason as part of your professional duties, you were asked to disclose something that doesn't fit within the treatment, payment, or healthcare operations buckets, know there's an authorization form. It needs to get completed before we can share that information. There's also certain disclosures that can be made for other reasons if we have certain permissions from people. Certainly with the COVID crisis going on, there was a variety of different information that the Department of Health and Senior Services or the governor's office was asking for. There are exceptions that they built into that. There are exceptions if you go through a courtroom proceeding in terms of what you need to do. But before you disclose anything to anybody outside of the practice, make sure that you've spoken to Melody or Dr. Wren or Dr. Lehrfeld to make sure that it's a permissible use of doing so. Because even if you think you're just helping somebody out and doing something for a convenience factor, if it's not done appropriately, you could get yourself and the practice in trouble. We obviously want to avoid that. As I said before, the focus of the privacy rule and HIPAA generally is the individual's rights of access and the rights that that individual has. And certainly for some of your patients that you're going to see, you're going to have to deal with their personal representatives as well. Make sure that they're actually designated as their personal representative. A spouse or a boyfriend or a girlfriend may come in. If he or she's not an authorized person you can share information with, you shouldn't share that information. And on the intake process for the patients, we have what we call a notice of privacy practices, and that will identify the people that patient X, whose information can be shared with patient X, family members or whatnot. We need to make sure we abide by those wishes in terms of what we need to do things. Folks have access to get copies of their medical records. It's not an uncommon thing these days. Just note that there's a timeliness obligation that we need to have and need to follow if we're going to share information that somebody requests. Even of their own, we need to make sure that we're giving it to them in a compliant manner. And again, there are policies that the practice has put in place to address this. There's other rights that people have. If people wanted to know how their protected health information has been changed, if they want to restrict information, if they want to know how many times their information has been disclosed, there's areas that we have to do from a compliance perspective. These are generally not regularly occurring circumstances, but if they are, we've developed policies that help address those situations. So again, from a recording standpoint, please make sure that this information is being shared and approved in advance by Melody, Dr. Wren, or Dr. Lehrfeld to make sure it's taken care of. There's other requirements that are built into the privacy rule. And again, we could spend extended time talking about each of these. Just know they're out there. We do have a privacy official, Melody, who's responsible for handling these issues. If there's a complaint process, there's something that needs to get followed. This exercise we're doing today is one of the training things that we need to regularly do, not only for our existing staff, but as we add new staff in terms of making sure they understand the rules of the road in terms of what we do and how we do it. There are safeguards that we built into place in terms of what happens. There's a complaint process if an individual feels that their privacy rights were violated. There's sanctions. Unfortunately, if somebody in the practice acts inappropriately and does something that they shouldn't do with respect to a patient's protected health information, there's recourse that the practice needs to have against that individual or those individuals. And this is built into the privacy rule. It's not something that Jersey Urology Group is looking to do to be punitive. It's actually a requirement that the federal government has imposed. And then if something does happen, there's also mitigation standards that we need to do. One important thing to remember, and this is common with many of the healthcare provisions, we can't retaliate against somebody. If somebody says we think there is a privacy violation and we investigate, we find there is, we can't punish the person who raised the issue or notified it. If anything, we should be appreciative that he or she recognized there was an issue and make sure that the practice is prospectively protecting itself for what it needs to do. The last piece is we can't have patients waive their rights. And again, from a policy perspective, there are lots of policies and procedures that we've put together. You don't have to know those policies and procedures. You do have to know that they're out there and there are requirements that you're expected to follow as an employee of the practice. And again, this applies to the physicians as well as the non-physicians in terms of what needs to get done. The important thing in any role of the healthcare world, as you know from dealing with your patients on a daily basis, is documentation. If just like the government says, when you're billing a third-party payer, if you didn't document and it didn't happen, same thing we need to do with respect to the privacy rule. And that's why Dr. Lehrfeld had asked at the outset to make sure everybody who was on the call, we can record their attendance and make sure you complete the quiz so we know that you participated in this compliance training. I'll pause for a second. Are there any particular questions that people have about the privacy rule before I jump into the security rule? Okay, we'll jump into the security rule. And again, if folks have a question about something, you can feel free to stop me accordingly. The security rule at the time when it came out was a more novel rule because it dealt with electronic protected health information when many practices were still paper oriented. In today's world with healthcare delivery the way it is, every practice basically needs to apply by the security rule because of the electronic transmission of their information. One of the curious things about the security rule is it sets up a variety of different safeguards that every covered entity needs to follow. There are administrative safeguards, there are physical safeguards, and there are technical safeguards. And Jersey Urology Group with Dr. Lehrfeld's assistance and leadership is doing each of these different things, but just know that they're out there in terms of how activities are handled, and we'll walk through some of those situations. We do have an information security policy as well, if you're ever curious about it, but again, this is something that every healthcare provider needs to make sure it has in place. So the security standards, as I said before, there are administrative, physical, and technical safeguards. One of the things that the government's created is they've created a scenario you can see with these different number of specifications that they have. There are certain specifications that they suggest are quote unquote required. As its name suggests, these are things that Jersey Urology Group has to do. No ifs, ands, or buts about it, we just have to do it. There are other implementation specifications which are what they call addressable. And for those addressable specifications, there's a thought process that Jersey Urology Group went through in terms of what are the resources we can do in terms of how we can effectively do something. A large hospital system might have deeper resources than Jersey Urology Group. Jersey Urology Group is going to have deeper resources than a solo practitioner in terms of what he or she has the ability to do. So there's a little bit more of a qualitative assessment in terms of how to make sure we apply to these things, and we have to document our decision making. Again, this has all been done, but just know if somebody says HIPAA security, there's a lot more to it than just making sure that your laptop or your desktop is secured in terms of what you need to do. A couple of different things you should think about that often come up from the security rule standpoint. Be careful about malware or malicious software. If you get an email that doesn't look right, it's probably not right, and don't open it up unless you talk to Dr. Lehrfeld or somebody else who's handling IT issues for the practice. Phishing expeditions happen all the time. Our law firm regularly sends out emails to our own colleagues to see if they're paying attention to what's getting sent out and to give them, fair advance warning if they do inadvertently click on something, to realize that it was a phishing expedition. You should be careful about what you're doing. So if an email doesn't look right, don't open it. If it's from somebody you don't recognize as an attachment to it, don't open it. Make sure that the last thing we want is somebody to infiltrate the Jersey Urology email system and either cause a virus or take information they're not able to take. As a general principle, don't put electronic PHI on your personal devices. We need to make sure it's protected. Some of the circumstances where the Federal Department of Health and Human Services, their Office for Civil Rights, that's the body who does the investigating if somebody feels there's a HIPAA issue. More often than not, it happens because somebody had a laptop stolen, had a phone stolen, and it was not protected with any encryption, and there was PHI on that device. So be very, very careful about information leaving the practice from any of the offices or the hospitals that you're attending to, or the surgery centers or the stone centers, about having any PHI on those devices. We don't want to have a security breach because somebody was doing something that they weren't supposed to do with the practice. Understand that there's regular risk analysis and management that the practice undertakes in terms of making sure that we think we're compliant with what we need to do. Password management, a pretty simple thing, and most of us have passwords for our personal business, banking accounts, credit cards, anything like that. Just like you would never share that with one of your work colleagues, don't share your work email with one of your colleagues. It's an easy way to jeopardize the integrity of the electronic PHI. So just be careful of that. Don't leave a sticky on your desk that says, here's my password, sitting right under your desktop so you can always remember it. Pick an email password that you're going to remember, but you don't need to share with anybody where it's in a public space that somebody else could see it. There's encryption and decryption rules that we'll talk about in a moment. It's becoming more and more routine when anybody's sending protected health information outside of the office, making sure those things are encrypted. Security incidents can happen. This is when somebody tries to get into the system because of something that we might not have protected appropriately. Be aware of those circumstances. Don't ignore it. Go up the chain with it. Let Melody know, let Dr. Lerfeld know, let Dr. Wren know about it. The practice takes this very seriously, and we need to make sure that we're, continually compliant. Hackers are always looking for new ways to get exposed or get access to information that they shouldn't get. We don't want somebody to have a ransomware attack where they're suggesting unless the practice pays a certain sum of money, they're going to release that data or destroy that data, because that's going to be very damaging to patient care. So just be very careful if somebody's trying to get into your system that you become aware of. So what happens if there's a breach? Just switching gears briefly, if there is a breach of protected health information, we have an obligation as a practice to make sure that we're recording that to a variety of different sources, depending upon the scope of it. If you think there was a breach of data that we did inadvertently, hopefully not purposefully, we did inadvertently, you need to make sure that the privacy officer and the security officer are aware of that, because we need to make sure that that's getting taken care of. You're probably saying, what is a breach? It's a little bit of a wordy definition. If you look at the top of this slide, it says what a breach is. It's basically doing something that compromises the security or privacy of the protected health information. Importantly, there are some exclusions. Now, we have to go through an analysis to figure out if something is actually a breach, but if there was something done in good faith and something unintentionally done without a further disclosure, it's quite possible we could argue that that is not a breach. If there was inadvertent disclosure of information to somebody, we could potentially argue that's not a breach. If something was disclosed, but we know nobody could access it, if you send something to an email account that was wrong email account and the email doesn't exist, we know that it can't be opened because it's not a legitimate email. We may be able to conclude that something like that is not going to be considered to be a breach. As a general premise, any PHI that we have that we send to another party that's not encrypted is going to be considered to be unsecured. I know there's encryption software that when you send things out, don't be hasty about it and say, I'm just going to send it to a quick email. I know, Bruce, it's fine. If you're sending PHI, send it in an encrypted manner. It protects you, it protects me, it protects the practice. It's the right thing to do. If you're dealing with other providers, in the course of your daily business, encrypt that stuff. They should expect to see something encrypted. It's going to be more unusual than not if somebody gets something that's not encrypted where it is PHI, and that raises the risk level for the practice. As I said before, there's a specific breach analysis if we ever have to have that. And again, it's not something you need to be dealing with personally. You'll be dealing with Melody or Dr. Lerfeld or Dr. Wren or me in terms of making sure we understand if there's a breach, because there's obligations on the practice if something happens. One of the hard parts about HIPAA and why this information is so important is something's presumed to be a breach unless we can demonstrate otherwise. It's presumed to be a breach unless we can demonstrate otherwise. And what we basically have to do is show there's a low probability that the protected health information has been compromised based on the risk assessment that we do in terms of how we handle it. So the burden's on us. We have to prove otherwise. So if there is a breach that involves you, you're going to be asked for information so we can help make that judgment in terms of what happened. If there's a breach and we conclude there's a breach, we can't overcome the presumption and we conclude there's a breach, there's a variety of different things that we need to do. If the breach relates to a patient, we need to let that patient know within 60 days of the breach. And there's often recourse that many practices and hospitals take care of with these things in terms of giving people credit protection, for instance, if sensitive information got out and making sure that their Experian accounts are not adversely affected because of the disclosure of information. We have to make a disclosure to the Health and Human Secretary Services secretary. If it's more than 500 people, heaven forbid, we hope that doesn't happen, there's going to be an immediacy element in terms of what we need to do. If it's less than 500 people, we still need to keep a log of that. And then on an annual basis, share that information with the department so they can do their own assessment in terms of what the breaches are. This goes back to the documentation piece that we'd spoken about before. If there's a breach of more than 500 residents that are involved, we're gonna have to go to the media as well. And for obvious reasons, we don't wanna do that. But if you pick up the local paper, you pick up the Philadelphia Inquirer, there's always a paragraph box almost every week that somebody made an announcement about a disclosure that they had a breach affecting X numbers of patients, or a payer, Aetna, has an issue that they disclosed information that they shouldn't have disclosed, and that information gets out there. It can happen. I prefer that we not be one of those people who has to make that type of disclosure. What do you do if there's a breach? We have a breach response policy. Don't hide it. Don't cover it up. Don't forget about it. Remember, that clock is ticking. We only have 60 days to do something about it. And we need to make sure there's a coordinated response in terms of what we're doing, how we're doing, why we're doing it. Like any federal law and most state laws, if something goes wrong, there's penalties. And again, I don't want Jersey Urology Group to ever have to deal with these penalties, but you can go, if you're ever curious, go to the Health and Human Services Department website, to the Office for Civil Rights. You can see there's a variety of different settlement agreements that they post when people have acted inappropriately and they did an investigation. As part of the investigation, they conclude something went wrong, but the party admits no wrongdoing, but they agree to pay the fine to make something go away. There are more severe penalties as well. You can see these numbers can add up pretty quickly. If you think about a typical medical record, if the government wanted to be aggressive, there could be 15 or 20 different pieces of protected health information in one medical record. If you add up each of these per violation, suddenly you're getting into very big numbers where somebody could be exposed to if something went wrong. It's something that the Jersey Urology Group takes very seriously. I need each of you to take very seriously that there are repercussions if something does go haywire. Here's a couple of different examples of different circumstances where a provider got themselves in trouble for something that may have seemed silly, but upon further review by the Office for Civil Rights, they uncovered that there were other compliance issues that covered entity was not compliant with. So they sort of aggregated as part of a settlement in terms of saying, if you agree to pay X, we'll let this go away, but you're gonna have to do some type of corrective action plan in terms of what happened, what has happened to you and how it's worked. So you can see these numbers add up pretty quickly. $400,000 for sending something to the wrong fax machine. A laptop was stolen. Somebody paid $2.5 million for that. A physical therapy provider paying 25 grand when patient photos were posted to its website because they didn't have the individual's authorization to disclose his or her identity. And if you can imagine what these fines are, the amount of distraction time that the covered entity had to take and hiring outside counsel to help them out, it's a very expensive proposition. So really, really, really be careful with what you do with PHI and how you use it. A couple of other examples here. Some of these are more recent. $10,000 settlement for somebody putting something on Yelp where they included a patient's information. Giving information to a reporter was a six-figure settlement. A solo practitioner. Remember we talked that any type of covered entity is going to be bound by this, whether it's a large hospital system, our large multi-office practice, or a solo practitioner. Here you have a circumstance from earlier this year. Solo practitioner paid $100,000 because they didn't do a risk analysis at the time of a breach report. So remember, something silly, you think there's a breach, you don't document what happened and how it happened, somebody then asks further questions about it, there can be consequences in terms of how that happens. So what do we do in terms of next steps? It's a lot of stuff we covered in a relatively short amount of time. It's important to periodically look at this information and do reminders of this in terms of what we're looking to do, and making sure, again, you'll see that quiz in terms of filling out that quiz in terms of how things need to be handled in terms of what we need to do. A couple of takeaways for you before I let Lisa jump in and share some of the important labor and employment and OSHA information. We need to protect protected health information. Absolutely need to protect protected health information. Follow our policies that we have in place. We have the policies there for a reason. We update the policies periodically if there's a new development or a new issue that arises. And then finally, if you suspect there's an issue, talk to Melody, talk to Dr. Lehrfeld, talk to Dr. Wren, talk to one of the other physician owners of the practice. It's really important that we get this addressed because the clock is ticking and you need to make sure things are squared away in the most timely way. So before I turn it over to Lisa to talk about some of the New Jersey law against discrimination and OSHA, maybe I'll pause there just for a minute and see if there's any questions about the HIPAA stuff that we went through. Lisa,
Hey Bruce, this is Dr. Wren.
Yeah.
I first want to say thank you for going through all that. I want to also thank our staff because I know you guys deal with this so well on a daily basis. As you hear all the background information about HIPAA, you truly remember as you're dealing with the patients and they always complain at the kiosk or they always complain when they call in, why can't you talk to me or why can't you address this? You remember why we do all these things. And so as you're dealing with the patients, remember, it's not us, it's not you. These are all federally mandated rules that we have to follow. You also see a lot of the things that we're talking about now. If you look deeply, you could see that we do all those things in the background that sometimes you don't notice when you have to type in the word encrypted on your email for PHI related information. Again, it's not to make everyone's life more difficult, it's just to follow the rules. So when patients complain to you, just try to reinforce with them, it's not us, it's not them, it's the law.
Yeah, and I would just add, Dr. Wren, I mean, that's a very fair point. I mean, everything that the practice is doing is great. This is intended as a friendly reminder to make sure that we're staying on top of it. And any patient who's complaining about something, I'd be shocked if one of the other practices or the hospital that they visit doesn't have similar, if not identical, or more stringent type policies in terms of how they handle things. So just take that for a grain of salt. As hard as you work and as demanding as some of the patients can be, it could be their frustration about something else that this is the only way they can express themselves in a way to convey their frustration about what's going on with them and their personal health condition. But we're absolutely just doing the absolute right thing in terms of protecting their information. It helps them, it helps us, and it avoids us being the subject of any government query. Why don't I at this point then turn over to my colleague, Lisa Koblin, and I'll walk through some of these slides. And Lisa's in our labor and employment group. She's been helping out the practice for some time now when periodic employment issues arise and making sure that we're taken care of. So Lisa, the floor is yours.
Thanks, Bruce, and it's nice to meet and see everyone virtually. Thanks for sticking with us. So we're going to run through the New Jersey law against discrimination, which hopefully this should serve as a refresher. I hope that you're all familiar with this and have an understanding that JUG has a very strict no tolerance policy for discrimination and harassment and related issues in the workplace. And so we're going to talk about that a little bit. So as it says here, the New Jersey law against discrimination protects employees from unlawful discrimination. This applies to all employers throughout the state, including the practice. Next slide, please. So what is discrimination? You might hear that term thrown around a lot, and it's certainly a broad term, but what we're really talking about here is something that negatively impacts the terms or conditions of your employment. Some sort of action or conduct occurred which affects your employment in a negative way. And this could be a one-time event. It could be a series of events. It really depends on the circumstances and the facts. But the main piece is what is the reason for it? And is it connected to what we call a protected status? And we'll go through those in a minute. Next slide. Okay, so we had a little bit of a IT issue here. No worries. I can tell you what employment actions we mean here. We're really thinking about adverse employment actions, which are things like discipline, suspension, termination, someone who didn't get promoted. These are sort of concrete events that you can pinpoint. And if somebody were, not promoted because they were a woman or not hired because of their race or something to that effect, that's the areas that are protected by New Jersey law against discrimination, that are prohibited. And whether it's, one manager, multiple managers, anybody who has the authority to make those decisions, cannot base those decisions on a protected category. Next slide. So can you go to the next one? So back one. Nope. Back. Back one more. There we go. Great. Okay. So New Jersey law against discrimination is really broad, and New Jersey, as you all may be aware, is a very progressive state that really has taken a lot of strides to protect employees of all different or many different backgrounds. This is a list of the sort of primary categories that are protected, and not surprisingly, everybody falls into one or more buckets, and it's just important that everybody is treated fairly and equally in the workplace based on, their skills, their experience, how they perform their job, and not based on their age or their sexual orientation or another area. Importantly, I do want to note here that this law was actually updated this year, given what's going on with the pandemic. The governor and the lawmakers did add an amendment which says that you cannot discriminate against an employee because they're suffering from COVID-19 or a related issue or infectious disease. So in the event that somebody were, somebody tested positive or had another similar disease, employers cannot, just take action against them because of that, just as you'd be protected for any of these other categories listed here. Next slide. So a big one that comes up a lot that we see a lot of questions about are disabilities, including accommodations and things of that nature. The NJLAD protects a large variety of disabilities, both physical and mental health issues. We've listed just a few here, but really it targets some sort of injury, illness, or chronic condition that prevents you from normal exercise of your bodily or mental function. So this is not a common cold. This is not the flu, usually not a broken bone even, although sometimes there can be exceptions, but something really significant that truly, impacts your ability to perform your job duties. And with COVID-19, on that note, if you have a symptom of COVID-19, we're going to talk about that. You need to be mindful of it. You probably need to stay home. We need to monitor all of that great stuff, but you're probably not considered to have a disability unless you were to have some sort of serious illness related to COVID. So on this note, let's talk about reasonable accommodations. Hopefully you all know that if you come, down with some sort of illness or injury, something happens that impacts your physical or mental ability to perform your job duties, JUG really wants to make sure that you have the resources that you need to be able to perform your job with or without a reasonable accommodation. So you should be going to Melody or Dr. Wren or another doctor and just letting them know that you need assistance so that they can go through what we call the interactive process to make sure that you get the assistance that you need. And that would be, assessing probably with documentation and doctor's notes, what's going on, what sort of accommodations have been requested, are they reasonable, meaning will they cause some sort of, hardship on the practice? Is your request for an accommodation actually related to your disability, or is it more of a personal preference, things of that nature. But ultimately, if you have a question or concern or you're having difficulty, please let them know so that they can work with you to make sure you get, the assistance that you need. Next slide. Another hot topic is sexual harassment. Of course, this has been all over the news in recent years and is something that the practice and a lot of other employers thankfully take very, very seriously and also have a zero tolerance, policy against sexual harassment. It's important to be mindful that sexual harassment can take many different forms. So there's what some people think is sort of the traditional, what we call quid pro quo sexual harassment. Like if you sleep with your boss, you'll get promoted or you'll get fired if you don't sleep with them. It's an exchange of one thing for the other. There's also just it could just be comments or gestures or emails or anything of a sexual nature that impacts your ability to do your work or impacts the terms or conditions of your employment. So it may, it would really vary depending on the circumstances, but it's important to know that, short of somebody, maybe grabbing you in a certain way or something physical, there's a lot of other types of conduct that would be considered harassment and are definitely prohibited in the workplace. Next slide. So hostile work environment is another area. Again, we apologize for the slide not fully showing up here, but the thing to know about hostile work environment is that it's behavior that has the effect of sort of being humiliating or intimidating, and it can consist of verbal, nonverbal, or physical conduct. So some examples of verbal conduct that could create a hostile work environment would be offhanded jokes or comments of a sexual nature or of any nature that's related to a protected class. So if somebody is making comments about someone's race or national origin, sexual orientation, all of those areas, and they're unwanted, they're offensive, they're threatening, anything of that nature, you definitely want to make sure you report that to Melody or another supervisor and that it gets addressed. In terms of nonverbal conduct, there could be pictures, magazines, sounds, gestures, I'm sure everybody can get a sense of what that could be, but the point is that it doesn't have to be a comment. It doesn't have to be physically hugging or kissing or touching. There's a lot of gray area there, and it's important to just be professional and, maintain a professional relationship with everyone at all times. Next slide. So as everyone should know from the employee handbook, the practice has a very strong anti-discrimination and anti-harassment policy, which prohibits discrimination and harassment, not just by supervisors or coworkers, but also by vendors, patients, visitors, really anybody that you're interacting with because of your employment with the practice. You should not feel that you're subjected to discrimination or harassment at any time. And of course, as we keep saying and reiterating, if you have a concern, whether it's about you or somebody else that you work with, please report it so that the practice can take steps to review what's going on, investigate the situation, and prevent it from happening in the future. We obviously hope that this is not something that anybody is experiencing, but you should feel safe to come forward and report it and know that it will be taken very seriously. And at the end of the day, the practice, their goal is to keep everybody safe and feeling safe at work. Next slide. So finally, for these policies, it's important to be mindful. Of course, they apply, in your typical 9 to 5 or 8 to 4 hours within the office, the walls of the office. But it also can apply in other situations too. For example, if there's a company-sponsored event, if you're talking to people in social media, either if you're permitted to talk on behalf of the practice or you're just speaking to coworkers who you happen to work with, who you happen to be Facebook friends with, if somebody were to start sending you harassing messages or discriminatory messages, even if it's outside of work, that could, impact the workplace and impact employees. And so, the practice would want to know if that's going on as well. So it's, in the workplace and even outside of the workplace too. Okay, I think I touched on this earlier, but we want to also be aware of retaliation and what that really means. And in terms of the New Jersey law against discrimination, retaliation would be taking some sort of negative or adverse action against an employee because they, complained or said that they, thought something was illegal and they wouldn't do it, or they were called to court to testify about something related to work, and then if they were fired or experienced some sort of negative adverse action that type of conduct is retaliation, and that's prohibited by the statute. So, you know, we want to always make sure that nobody is engaging in any conduct of that nature, whether it's a comment, whether it's a threat, whether you are actually, you know, something actually happens to a term or condition of your employment. If there's any sort of question about the motivation behind that, or, you know, if you have a concern that there's retaliation, just like with harassment or discrimination, please come forward and know that any good faith, reasonable reports, you know, you will not be subject to discipline or fired or anything like that for reporting a concern. So just to recap briefly, with respect to the New Jersey law against discrimination, it's important to obviously understand and follow the law, review your handbook and any related policies, and most importantly, if you think there's an issue, or even if you're not sure, but you think, no, I don't know how that, you know, how that comment was perceived, or, you know, I've heard that joke one too many times, it's really rubbing me the wrong way. Somebody, you know, is doing something that makes me feel threatened, anything of that nature. You know, again, we really hope that you're not experiencing that. We know that a lot of you have worked closely together for a long time, and the practice is very proud of that. But if you do have any concerns, please come forward with them. Okay. So I'm trying to move through everything fairly quickly to be mindful of everyone's time, but I will just pause here briefly. Does anybody have any questions about the law against discrimination? Okay, great. So now we can talk about everyone's favorite topic, I'm sure, which is OSHA, which is really, you know, the federal law and the federal agency that enforces safety guidelines and standards for the workplace. This applies all over the country. It applies to Jersey Urology Group and every other medical office essentially throughout the country. Next slide. A little background about OSHA is that under OSHA, employees have a right to work at a job site that is free of hazards that are likely to cause death or serious physical harm. I think, you know, when people think of OSHA, they probably usually think about, you know, a construction site or somewhere where there's a lot of power tools, or a crane or scaffolding where someone could fall and they have to wear a hard hat. And of course it applies there, but it's equally important to remember that, you know, we need to prevent hazards and do what we can to prevent serious injuries in the workplace, even if you're in a doctor's office or a similar environment. So under OSHA, one of the biggest areas that that comes up is related to bloodborne pathogens, which are these microorganisms that are present in blood that can cause various diseases, including HIV, hepatitis B, and many other, you know, diseases as well. I'm sure that you can all imagine it's really, really critical to be very, very careful with, you know, any patient blood samples or other bodily fluids that you may come in contact with, or that may just be present in the practice as a result of the type of treatment that's going on. So in that regard, the Jersey Urology Group, whether you sort of officially realize it or not, you know, utilizes an exposure control plan, which is made up of several components, including devices that minimize exposure, using the safest medical devices that are practical for your industry and the type of services that are performed at the office, seeking feedback and input from employees who have direct patient care to make sure that people are comfortable and understand how to properly use the devices that they're working with. Of course, cleaning and decontamination practices are really critical. So even though, you know, you may not sit down and think, oh, this is part of my exposure control plan, they're all related and they're all critical. And just like if you had a question or concern about harassment, Of course, if you have a question or concern about a device, about cleaning, about any part of patient care, whether you've done it a million times or it's a new practice, anything, please go to Dr. Wren or any of the other physicians and seek guidance and clarification. According to OSHA, it's also important to remember, and this might seem kind of basic, but if there's ever any confusion about whether a fluid is just water from the sink or some other fluid, treat it as if it's bodily fluid with bloodborne pathogens and use the utmost care. Don't just, take your chances and clean it with a paper towel with no gloves and not worry about it. I'm sure you all know that, but I have to say it as part of my job. Okay, so on that note, no, stay on that slide, go back. Bruce is just so excited to keep talking about bloodborne pathogens. On that note, it's critical to use any PPE, personal protective equipment, that is provided by the practice or that you're instructed to use at the practice, which will depend on the situation, the nature of the care you're providing, whether you're interacting directly with patients or you're at the front office, things of that nature. It should go without saying, but of course, and I know that everybody does this, but again, just be mindful that you do not want to have any food, drink, contact lenses, anything of that you would, ingest or put on your face or, put in your eyes near the medical equipment, near bodily fluids, anything like that. I know sometimes it's, you might be running from place to place and you don't have a lot of time to, maybe have the break that you want to have, but just be cautious and be smart about what you're doing. I'm sure you're all taking great care, but be mindful of that. And also make sure that you continue to label any waste containers and dispose of sharp objects as required by your office policies. It's really important, as you can guess, and as you know, to continue to follow those practices, because those are the areas in the doctor's office that are probably most likely to lead to some sort of serious hazard that would cause a safety issue to you or someone else. Okay, so just a general sort of overview of where we are with OSHA. Understand if you see a potentially hazardous substance or something that you think could be hazardous, report it, understand what's going on, understand what PPE you might need to deal with it. Everybody should know where the exit routes are in your office. And if something's flammable, that should be labeled clearly, and you should be following all guidelines that come with any sort of chemicals or substance that you may be dealing with. And I'm going to just say this again, even though I've already said it. If you see something, say something. Even if it's a small hazard that you think, oh, somebody else will get that, or I'll deal with it later. As soon as you're able to, as soon as possible, please report that hazard to one of the physicians or anybody who's, sort of a point person to address those situations, not only for your own safety, but for the safety of the patients and the visitors of the practice. Okay, so I do want to recap briefly a bit about OSHA with respect to COVID-19. Pretty much, I think all of this is actually captured in the PPE memo that you all should have received. It was either the beginning of this month or the end of last month. So if you have any questions, you can refer back to that memo. But I think everyone is probably aware that there are a lot of new spikes that we're seeing with COVID-19 around the country. Thankfully, not necessarily in New Jersey at this point, but certainly in other locations. And it's really important to stay vigilant in your own care and how you interact with patients and how you interact with each other. So please keep that in mind. Most critically, if you are sick, please stay home. I know that for the most part, you all should, the practice has a generous PTO policy. So take advantage of that. If you have any questions or concerns about staying home, contact Melody or Dr. Wren, and they'll work with you to figure out the best solution. So in terms of just daily sort of care that you can take, hopefully, I'm sure you're all washing your hands very frequently, especially if you're interacting with patients. And even though it's easier said than done, continue to avoid touching your face and continue to, cover your nose if you sneeze, all of that. Most importantly on this slide, if you do not need to be within 6 feet of someone as part of your job duties, don't do it. I know that you're probably close with your colleagues. If you're in the office, maybe you're used to taking a lunch break at the same time as someone or going on a brief walk or whatever you may do, and that's fine, but wear your mask, keep your distance. I know it's really hard to be physically distant from people these days, but please continue to keep it up as much as possible. Another thing that you'll want to make sure you're aware of is I know the practice has been very vigilant about screening and testing both employees and patients and monitoring for symptoms. But if you suspect that a patient, maybe they don't have a fever, but they're brought into the waiting room and all of a sudden maybe they're wheezing and coughing or something happens where you think this is not, this could be related to COVID, or they say something that causes you to have concern, talk to a physician and make sure that that patient is isolated from other people and that you have an exit strategy to get that person out of the practice, out of the physical practice if you need to, so that they don't come in contact with any additional people. I know it's really hard to sort of spot that physically these days, and you want to imagine that people who are sick are staying home, but better to be safe than sorry. And if you have concerns, you need to take action and reschedule the appointment if you have to. The other thing is make sure that you continue to, wear your face masks, which are required by the governor's orders. And if you have any concerns about, maybe your face mask got dirty or you left it at home or whatever the circumstance may be, take the time to be safe and get the protective equipment that you need before carrying on with your job duties. Finally, here is a summary about, I guess what I've just said and sort of next steps with respect to OSHA. We provided some links to some resources in case you have any more detailed questions or you want to, for any reason you want to do some fun reading and look at the statutes, you can do that through these sites. And also just remember that if you report any questions or concerns about OSHA, the practice is not going to retaliate against anybody for bringing those concerns forward. I think that's it for me.
Great. Lisa, thank you. Are there questions that anybody has for Lisa with respect to any of the law against, or either of the law against discrimination or OSHA? If not, Dr. Wren, if you want to wrap things up, we appreciate everybody's participation. I know that there was a quiz that I think Melody or Dr. Lehrfeld had shared with everybody. If you can get that back to Melody or Dr. Lehrfeld with your answers to it, that would be great. It's really going to follow the information we provided today, and it's important from an attendance perspective to make sure we know everybody was hopefully paying attention and hanging on every word that we said, and more importantly, understands where the resources are, that if you do have a question, you don't need to handle it alone. Reach out to Melody, reach out to Dr. Wren, reach out to Dr. Lehrfeld, reach out to any of the doctors in the practice, because we consistently want to make sure that Jersey Urology continues to do the right thing and abides by all of these different requirements. So thank you again for the opportunity to do this. Dr. Wren, we ended about 7 hours early, so people can have some of their Friday night free for themselves now, which I'm sure they're quite grateful for. So I'll stop there.
I'm very disappointed by that early end, but I do want to thank you and Lisa for all the help you provided us and the whole team up at Saul Ewing, Arnstein and Lair. I got to get used to the other two. For everybody, please get your tests back to Melody by Thursday at the latest, because I want to get them graded by Friday. If you get one wrong, it's okay. We just want to make sure we can educate you so that we get these really important concepts down. So thanks everybody for your time. I appreciate it.
Have a great day.